Now, the decision by Health Secretary Jeremy Hunt to reduce services at Lewisham Hospital in South East London has been declared unlawful and quashed by the High Court. Mr Hunt had approved the changes at Lewisham Hospital as part of plans to deal with financial problems at a neighbouring trust. He's been given permission to appeal against the decision. We can talk now to Dr Tony OSullivan, who's the Director of Children's Services at Lewisham Healthcare and was part of the Save Lewisham Hospital campaign. He's in our central London studio. Very good evening to you. Thanks for joining us. You must be mightily relieved this evening, but are you worried about the government's plans to appeal?
I am in one sense, but I have great confidence that the huge support for the hospital that's come from the community and an alliance of the council, GPs, church ministers, people in the hospital themselves won't go away. Andrew Lansley and Jeremy Hunt have lit up a campaign to defend the NHS that won't go away. So I know that the government is intending, and NHS England is intending to pursue this on the final day of our judicial review hearing. The timing not being a coincidence, there was an announcement from NHS London that they were intending to downgrade 9 A&Es and disperse maternity units. And Lewisham was named in that list on the very day of the judicial review, but before the results. So yes, I'm worried, but I think we have a response from our community that won't go away.
And clearly this is a matter of great emotion for the people in the community who campaigned to save Lewisham Hospital. We heard someone there in Carl Mercer's report saying, that she'd had both her children there, and clearly people didn't want to lose those local services. But given the acute problems facing the NHS, the budget shortfalls, the need to restructure and save money, isn't there a fundamental problem, not just with this campaign, but with any Save the Hospital campaign, that people need to start thinking in quite a hard-headed way and not with their hearts?
Well, there are a number of points there. First of all, as a paediatrician and as a member of a group of clinicians at Lewisham Hospital, we have never stopped changing in developing the NHS. And where there's a strong argument for centralising services, such as paediatric surgery, which left Lewisham Hospital 3 years ago to go to Evelina to be aligned with support units and the paediatric intensive care, we have supported that, reluctantly, but we've supported it. The earlier interview that you had, they were talking about there's got to be change. Well, I want to know what kind of change is justified when the projection for Lewisham community is that there are going to be over 300,000 people in 5 years' time.
I totally take your point, but would you accept the point that if every hospital that is threatened with closure there is a campaign then to save each of those hospitals, which clearly takes quite a long time as it goes through a legal process, then the NHS is going to run out of time in which to make the changes that it needs to make and the savings that it needs to make?
Well, there have to be merits for each case. And Lewisham Hospital has 5 years running been one of the top 40 hospitals. It's the third best performing hospital for A&E in London at the moment. We have had numerous accolades. We've got one of the best children's services, I think, in the country for a district general hospital. How is it logical that the government tries to close down one of the best hospitals at a time when, out of Stafford, and the previous interview was talking about quality, Lord Howe is talking about quality and safety of care. How can you justify closing one of the best hospitals at this very moment in time? We have to ask ourselves why the NHS is short of money. Now, I know that at least £6 million has been wasted on an unlawful process in South London. I know that the government has spent hundreds of millions of pounds on consultancy firms like McKinsey. I know that PFI, private finance initiatives, brought in by successive governments, are actually crippling the NHS. Now, can we just get... One of my patients said to camera recently that Jeremy Hunt needs a reality check. We do need a reality check. The reality is that we need an NHS We need local hospitals for 90+% of acute illnesses. We, of course, need centralised specialist services. Clinicians and the community, who are far from stupid, will support that. But we have to know where the hemorrhage of money for PFIs and other waste money on consultancies, where is that going? It's not going into healthcare. I don't believe Stafford is a terrible hospital. I believe it's been underfunded. Lewisham Hospital's been underfunded, and we've done our very best, and we've been financially stable for 7 years running. The government needs to think seriously about what they are doing with their priorities.
Okay, well, Dr. Tony OSullivan, it is a very interesting debate. Thank you very much for your time this evening, Dr. Tony OSullivan there from the Save Lewisham Hospital campaign.